Well, welcome Associate Professor David Szmulewicz. You're a neurologist from Melbourne, and today we're going to be talking about peripheral nerve damage. So Dr. Szmulewicz, what are we talking about when we refer to peripheral nerve damage?
So let's first talk about what a peripheral nerve is. So a peripheral nerve is a nerve that starts at the spinal cord and extends out to the periphery, for example, to the hand or the leg. And it carries information both ways. So sensation will travel from the periphery, again, let's say the palm of the hand, back towards the spine, and instructions for control of movement will travel the other way from the spine out to the muscles. And so that's a peripheral nerve.
Thank you. What are some injuries? What are some kinds of injuries that people are diagnosed with that involve peripheral nerve damage?
Yeah, so injuries will include compression injuries, where a force has been applied to the nerve, for example, a heavy object that falls on a limb, and this may compromise either the ability of the nerve to carry sensation or to issue control to muscles. And what's important here for us as neurologists is to identify, is it one nerve or is it more than one nerve? Or is it in fact more than just the nerves, but an area where the nerves converge? And these are called plexuses. Or is it at another site called a nerve root, where the nerve exits the spine? And this is important because the outcomes may be different. The patient's capacity may differ, and also impairment ratings, where relevant, will differ depending on the site of the nerve injury. Now, in addition to scans such as MRI, what are sometimes helpful are nerve conduction studies, which measure the ability of the nerve to carry information. And so at times we may request that a nerve conduction study and/or an MRI is done to further clarify the site of the damage where it's not obvious from our physical examination. Having said that, most of the time we're able to pinpoint that from the neurological examination.
Clearly it makes a big difference in terms of outcomes, return to work outcomes and future earning capacity as well, doesn't it?
Absolutely.
So what kinds of treatments are available for peripheral nerve damage issues?
So there are a number of treatments, partly depending on the nature of the injury, but these include rehabilitation or physiotherapy. They may include the use of orthotic or prosthetic devices, and in some cases surgery is sought, and that may be, for example, where there's a site of ongoing compression of a nerve and yet the nerve is still viable, then the advice would be to seek surgery to decompress that site. And less commonly, nerve transfers are recommended, where nerve tissue from one area is transplanted to the damaged site in the hope of regaining a level of function.
What kind of treatment's available for nerve pain?
Largely where there's been ongoing nerve pain, and so there may no longer be other treatment options. There are specific medications that are used for what's called neuropathic pain or nerve pain, and these are most often prescribed by neurologists or pain physician specialists, and are much better at controlling nerve pain than the regularly used and known painkillers, which tend not to be all that effective. Unfortunately, we do see a lot of patients where the nerve pain agents have not been trialled. And so this is another not uncommon outcome of an assessment that a neurologist will make.
Thank you, Dr. Szmulewicz. Peripheral nerve injuries can be quite complicated. I guess if a case manager or a lawyer is in doubt, they have the option to reach out and have a chat to you about any concerns they may have prior to writing a letter of instruction seeking your advice.
Absolutely. we're always happy to have a preliminary discussion, particularly about the appropriateness of the referral.
Fantastic. So thank you for your time today. You can, of course, be booked for independent medical opinions through the MEDirect platform. Thank you so much.
Thank you.